28, Ministry of Health, a supplementation of $244,582,640. I will now invite the Minister of Health to make a brief opening statement for a maximum of 5 minutes. Minister.
Thank you very much, Madam Chair. Madam Chair, this supplementation falls under 3 major categories. 1, for the COVID-19 response to set up the parallel healthcare system, in which to date 589 persons have been treated and or accommodated. We spent money on 4 major headings: consumables, HR, infrastructure, and equipment, and this was used to supplement the 2020 allocation. The second major item for expenditure was a loan taken out with NIBDEC for the procurement, storage, and distribution of pharmaceuticals and non-pharmaceuticals. The third major area for the supplementation has to do with infrastructure, especially for loans taken out to build and construct the central block, and surprisingly, loans for the Arima Hospital, because the Arima Hospital, contrary to folklore, was never built cash from monies taken from NGC. So these are some of the reasons why we have the supplementation, and I am now prepared to answer any questions.
Thank you. Honourable members, the question is that the 2020 appropriation for Head 28, the Ministry of Health, be supplemented by the sum of $224,582,640. Member for Faizabad.
Madam Chair, Minister, with regards to the item contract employment of $3,034,295, can you indicate, with regards to those 11 new ICU nurses, the terms and conditions of their employment and where they have been deployed?
Sure. So the terms and conditions of the employment have been decided by contract between the government of Trinidad and Tobago and Cuba, as you know. Their monthly rate of income is 6,300 TT, housing allowance 2,000, transport allowance 500, incentive allowance 1,575, meal allowance 625, consolidated uniform allowance 2,004. Remember, when employees leave their country, they are paid displacement allowances, even if you are leaving Trinidad to go to Tobago and Tobago to Trinidad. Their deployment is as follows. And let me state, these are intensive care nurses for which we have a shortage in Trinidad. So we are not disadvantaging any local nurse, as you know. Their deployment is as follows. Eric Williams Medical Sciences Complex, 4. San Fernando General Hospital, 3. Port of Spain General Hospital, 2. And Scarborough General Hospital, 2.
Yeah. Sorry, did you mention the duration of the contract, Minister?
3 years.
3
Sorry.
years.
Yeah.
Minister, in view of the shortage of the intensive care nurses, can you indicate whether any training plans are there for local nurses?
So under the Office of the Technical Director of Nursing, we have in Trinidad now instituted, and the first batch is already completed, an intensive care nursing program for Trinidad and Tobago. So we are hoping that our local nurses can upgrade their skills, and that is underway.
Can you say at this time how many expected to be graduated?
I can't give you the exact figure.
Minister, with regards to the 20 doctors attached to the Ministry of Health's program, can you indicate their terms and conditions and how they were recruited?
So these 20 doctors were recruited to man the hotline, the COVID hotline. They were paid a stipend of $5,000 a month. They were not called upon to do medical duties, but to man the hotline. So far, I could give you some figures to see what they have done. From May 1st to May 21st, 2020, there were 1,000 calls. But what we are doing now with the hotline, as we have gotten over the first wave, so to speak, we have retooled the hotline to provide a little more robust mental health support and direction for callers. And we are also retooling the hotline as a crucial tool for reporting of events, event-based surveillance. So if a member of the public sees something and they want to report it, they can report it to the hotline. So in all so far, between infrastructure and staff, we have spent about $100,000 on the hotline.
Yeah. You also mentioned, this also mentioned other staff. Can you give us an idea of what that entails?
So other staff will be things like extra catering during the, when we had our first case of COVID from March 12th and so on, additional security and so on.
Okay, I'll continue here. Thank you, Madam Chair. If I can just move on to the allocations for the individual RHAs, Madam
Yes.
Chair. And just to look at the expenditure with regards to the Eastern RHA, that $33,113,990. Minister, can you give us a rough breakdown of how much has been spent?
Sure.
I just wanted to clarify first of all, though, is that the estimate going forward from now
I
until
can
the
give
end
you.
of the
So those were the allocations, the actual amounts spent to date, and I have it here. Right. Eastern RHA, they were allocated $33,113,990. They have committed and spent to date $3,260,993. For the Northwest Regional Health Authority, they were allocated $16,606,000. To date, they have spent and or committed Northwest, right, sorry, $3,712,602. For Southwest Regional Health Authority, they were allocated $5 million. I will get that figure for you. And for North Central, where the bulk of the money went, they were allocated $129,950,000. They have spent to date $23,843,101. The total expenditure across all four RHAs in Trinidad, and I will confirm one figure for you, is $45,832,458.
Yeah. So, Minister, with the ERHA, you've only spent just over $3 million out of a $33 million allocation.
To date, yes.
Can you indicate to us what that additional expenditure? Why would you have asked for such a large allocation?
Well, remember
Can you clarify whether this allocation is for the end, towards the end of the financial year?
Yes. No. So when I went to Cabinet initially to ask for the money, we were allocating funds for the first 3 months of the COVID response. You have to remember, in those days, facing this for the first time, we had no experience to go on. We had no precedent. So we tried to come up with a worst-case scenario so that we don't have to go back to Cabinet every 2 weeks. And this is the scenario we came in with. And so far, we are, Cabinet had approved $157,000 roughly. And to date, we have spent and or committed $45 million roughly.
Yeah. I just wanted to ask with regards to the SWRHA allocation. I know that there were plans to operationalize the Augustus Long Hospital.
Yes.
And I'm assuming that the Augustus Long would have come under the SWRHA.
Right.
Can you indicate what sort of expenditure would have been incurred at the Augustus Long, and where we are in terms of preparedness, and what is the facility being used for currently?
So in the case of Augustus Long, it did not come out from this allocation because Heritage Petroleum outfitted and spent the money on Augustus Long. Augustus Long will be ready or is ready. If you hold on 1 second, I will give you the details. It will be ready by the end of this week. It is to be used for tertiary care because we are outfitting that with ICUs and ventilators and so on to help supplement what is going on at Couva in the case that the global pandemic revisits our shores.
Right. And the staff allocation for Augustus Long would come from one of the current hospitals, or will it be new staff being employed?
It will be a combination of new staff and existing staff from Southwest RHA.
Can you indicate the expenditure from Heritage Petroleum for?
I wouldn't have that figure with me.
Could you undertake to provide that in writing for us? Just one more question, Madam Chair. Now, as part of the preparation for the COVID-19 and preparing for the worst-case scenario, you would have mentioned the procurement of additional ventilators.
Yes.
Can you indicate how many new ventilators have actually been procured in the country at this
Sure.
time?
So pre-COVID, there are approximately 123 ventilators across the healthcare system. In assuming the worst, we decided that the evidence at that time showed if you have 100 cases, 5% or 5 will need ventilator support. So at the start of our response back in February, worst case scenario, we were saying at that time, if you have 1,000 cases of COVID in Trinidad, 5% of 1,000 is how much? About
50.
50? Right.
I think so.
We brought it up to 74. So we were actually catering for 1,500 positive cases, of which 5% will need ventilator support. So we took up the ventilator count for COVID only, not touching a single ventilator in any of the other hospitals as a parallel healthcare system to 74. At any one time, we never used more than 4 or 5 at any one time. So we were oversupplied with ventilators, but we were planning for the worst.
Right. So you're saying the number of new ventilators is 74?
Approximately,
For
yes.
clarification. Okay. I'll just hold it.
Okay, so on Parisano, thank you very much, Member for Faisal.
Yes, sir.
You said they get a salary of 6,300, etc., and it went down with the breakdown. Do the nurses get this salary directly in their hands?
That I will have to check. I know it's under government arrangement with Cuba. I don't want to commit an answer and be incorrect, but I will check for you, sir.
Okay, another thing, on the section on 009, with the Northwest, Eastern, North, and South, the values there, you said you spent $45 million.
To date, yes.
So to date, how many people have been tested so far?
The number of people tested so far is number of patient tests, 2,952.
How many people are positive?
117.
And how many people were quarantined?
Quarantine to date, so you take out, I just gave you a figure, I think 589 persons have been either treated and or quarantined in the parallel healthcare system. A total to date of 589.
My question, Minister, is that given the small amount of people who are quarantined versus that people who are tested, do you think $45 million, etc., is value for money?
Okay, so let me give you one example, because I was shocked when I got this figure this morning. When we were looking, and I have the figure here, one of the drugs that we have to use, and you will know, is a drug called human globulin immune. You know, each patient that we have to put on that costs between $100,000 to $200,000 per patient. So that's why you just can't look at some basic costs. Meropenem injectable, we had to spend $792,960 on that alone. Sodium valproate, because you have to control their seizures, $1 million, and that was provided free of charge. But what was shocking was the human globulin immune. Each patient could eat up between $100,000 to $200,000 in one drug. One drug. That does not count the paracetamol injections, the propofol. It doesn't count the PPE. It doesn't count the cost of infrastructure to set up the systems. Safety goggles, $86,000. Caps, $193,000. Methylated spirits, $500,000. It's an expensive undertaking, member.
You have, further question? On 04, 011, 06, the financing of the Arima Hospital for the completion.
Yes.
Could I ask a question. When did this financing for the Arima Hospital begin?
Okay, so in coming into office, there was no long-term financing. I think your administration would have had some agreement with the China Exim Bank. That was never signed, sealed, and delivered. This Minister of Finance sought long-term financing through local banks. And on this particular line item, there's a RBC loan for US $16.9 million over a 10-year tenor. The sum is required to facilitate the payment of interest on a US $16.94 million 10-year fixed-rate loan for the completion of the Arima Hospital. There were several loans taken out to finance the Arima Hospital, both in US dollars and TT dollars, because contrary to folklore, the Arima Hospital was never funded cash from NGC money. The taxpayer had to incur these loans.
Thank you, Minister. Could I also ask if any money was paid out before the elections of 2015?
What I could tell you, 1 week after being appointed a brand new Minister of Health, China Railway came to me and said, Minister, you owe us the remaining 5% of the 15% down payment, which was due in May of 2015. So the administration at that time did not complete their payment of 15%. We had to pay it out in November of 2015 because at that time the monies were used for other purposes.
So therefore, Minister, the work had started before 2015?
No
September.
work actually started. There was a short turn-in. The same way the Couva Hospital was open for election purposes, there was a short turn-in. There were no completed designs. Designs were completed in January 2016. Hard construction started in March 2016. And that is the true story and facts of the Arima Hospital.
Are you then saying that the foundation was not started before September 2015?
Okay.
You could have...
All right. So I've allowed...
It was.
Minister of Finance,
I'd like to come in,
Madam
Chairman.
And Minister of Health.
Madam Chairman, with your permission, I'd like to come in, please.
Well, I'm so happy you said with my permission after I finish. I've allowed a lot of historical context. I am always reminded that the Minister of Finance tells us that this discussion is based on what is before us. So I'll ask us to now discontinue this line of conversation. Member for Chaguanas East. No? Member for Couva South.
Thank you, Madam Chair. Minister, with respect to contract employment, right, could you just give a breakdown in terms of the $3,034,295? How much has been set aside for the nurses from Cuba, the 20 doctors, and the other staff?
Okay. So the sum was required to supplement what was allocated to us in the 2020 budget. It was done. I gave you the breakdown for the salaries of the nurses. I gave you the breakdown for what we are paying the doctors and other staff. If you want further details, we can provide that to you in writing.
And could we have that by Friday?
We'll certainly endeavor to do that.
And with respect to the allocations to the respective regional health authorities, you have indicated, and the sums of monies have been stated in terms of the supplementation. How much has been set aside in the respective regional health authorities for infrastructure and equipment and additional human resource services?
Okay, so I will get those details for you. But those were the total details, those were the total figures under the headings of personnel, infrastructure, HR, consumables, but I can get the details for you.
Madam
Infrastructure
Chairman,
and equipment.
No, it was another item. It was another item that is relevant to this fiscal year and this supplementary appropriation. Okay? It was an item that was under discussion that was closed off, but I wanted to make an intervention.
And
Not,
it's related to this.
not historical.
It's related to this.
Yes, madam.
And it's current, as you
Current.
remind me all the time.
Not historical.
I give you an opportunity.
But
But not on this item. It was on a previous item.
All right,
The one
well,
that
we'll
was
take
closed
you,
off.
we'll take
Yeah.
you all later.
Yeah.
Yes, member for Couva South.
Yeah, Madam Chair, I hope that the minister will provide the information as it relates to infrastructure and equipment in relation to tents and whatever financial arrangements that exist between service providers and the respective regional health authorities.
Oh, yes, Madam Speaker, I do
Yes.
have the details here.
Sure.
Yes, I found them. It's a pretty exhaustive list. Do you want me to call it out or supply it to you?
Well, for the record, and you can call it out.
Okay, so let's go. HR under ERHA, $353,807.53. For equipment, $819,151.54. Consumables, $1,679,303.54. Facilities, $408,730.90. North Central RHA, HR, $2,080,551.82. Equipment, $5,046,893.91. Consumables, $5,708,902.22. Facilities, $0. Northwest RHA, HR, $1,136,214.21. Equipment, $730,666.61. Consumables, $1,027,310,043. Facilities, $818,410.53. Southwest RHA, HR, $9,790,008.85. Equipment, $733,064, no cents. Consumables, $5,189,501.91. Facilities, $36,250.08.
Thank you very much.
You're welcome.
Member for Faisalabad.
Madam Chair, Minister, I just want to draw your attention to one of the loans here, item 04-00920. That's the interest payment to the Answer Merchant Bank. And it is indicated here that the loan of 500 million has been upsized to TT 1 billion, and it says to finance expenses related to the RHA's COVID-19 pandemic projects
Yes.
and programs. So that's an increase in the loan of $500 million.
Correct.
Can you indicate what these COVID-19 pandemic projects and programs are going to be undertaken by the ERHA?
Most of this loan was taken under ERHA for all the RHAs to pay mainly trade payables that would have accumulated over time, in addition to some COVID response.
For all of the RHAs?
Yes.
Okay. Can I, so it was just a matter of the contracting of the loan
Correct.
was done under the ERHA?
Correct. And distributed amongst all the RHAs.
Yeah. Would you be able to provide a breakdown
Of course.
in writing
Yes.
by Friday?
So the first loan was for $500 million. That went to trade payables. There was a second loan for 500, of which 249 million has been used. So there's a balance of about 251
Which is expected to be used
to
for
be
the end of
used
the financial
mainly
year.
for trade payables.
Okay. Item 04-01105, NIPDEC. I just wanted to find out, Minister, can you indicate when that loan was finalized? That's a loan for
Yes.
671,328,27.7.
So that would have been finalized in late 2019, early 2020. It's a 7-year fixed rate loan that facilitates the purchase for both pharmaceuticals and non-pharmaceuticals for the fiscal 2020 period.
So, Minister, can you indicate when these funds were disbursed to the government?
When is what? Sorry?
Do you know when? Can you indicate when the funds were disbursed?
Okay, so to date, 262.5 million has been drawn down or disbursed.
And that would be for all of the consumables in the RHAs?
To date, yes.
Okay.
Okay?
Madam Chairman, the item that I wanted to speak about was the next one, which is current. 04-01106.
06?
Yeah,
That's a Remo.
yeah.
Has a question been asked?
No, I was trying to answer some of the points when you said you don't want historical information.
All right, okay, so,
I
we
wanted to
we have-
clarify this.
okay, 1 minute, Minister of Finance. We have the member for Barataria Sangwa coming up, so I feel you'll get an opportunity there.
No, but I wanted to deal with some of the questions
Yes,
you had
yes,
asked.
and that's what I'm saying.
He may
the
not ask them,
questions-
now that he knows that I'm
No,
going
no,
to.
1 minute, please.
He may not ask them.
Minister of Finance, I'm saying that I have the member Barataria Sangwa in the lineup. You may get an opportunity.
But he may not ask the question.
Okay, so member for Tabakit.
He may duck and run.
Yeah.
May duck and run.
Madam Speaker, I want to deal with 04009, 2, 3, 4, and 5 strokes, that together. Minister, through the Speaker, you said about, well, when I added the top, about 45.8 million has been spent under these 4 RHAs so far.
Which line item
No,
are you?
04
Mm-hmm.
009 2, and I'm taking 2, 3, 4, and 5 together,
Okay, right.
right? So 45.8 million about that has been spent, right?
Yes.
Of the amounts here. Is that your figure to date, and do you expect to spend much more, or what are you projecting to spend out of all of these here?
Okay, so it is difficult for anyone at this point in time to say how this global pandemic will play out in any country. What I can tell you going forward is that a lot of the expenditure is going to come in quarantine and free of charge returning nationals. It is not a cheap endeavor. If you would notice, cases 115, 116, 117 occurred over a month ago. So most of the money going forward, if we don't get community spread, is going to be spent on quarantining returning nationals as we bring them back in an orderly, strategic manner that we can cope with.
Mr. You said...
And we also have to work on the assumption that for every national we bring back, that's a potential positive case. And then that goes into the hospital system, where you have to now spend money to treat them, and then eventually in a convalescent setting. So it is impossible to say how much money is allocated for treatment, convalescence, step down, because we have to work on the assumption
the point I'm making,
that the
Minister,
Minister of National Security, who is bringing in over 1,000 persons over the next week, we have to assume that 50 to 100% of those persons could potentially turn positive, as we see with the cruise ships.
I'm not arguing about the cost there. I'm just trying to establish that the bulk of the COVID seems to have flattened, and you've spent 45. I agree there's a risk with the imported cases still coming back. All right. My next question is this: you said you have 74 ventilators.
Yes.
Right. Those are new ventilators, Minister?
Most of them are new, yes,
Right.
yes.
Mr.
We
Minister-
bought some and we got some, there were a few donations,
Right.
but most of them we bought.
What steps are you taking to ensure that these assets will be protected, and how are they going to be, if distributed in the RHAs? Because, you know, I was reading where the ventilators, if they are not used and not checked and so on, they become of no value.
Correct.
So what steps are being taken to protect what is a major costly investment of 74 ventilators?
A major cost investment of what?
To protect a major expenditure on
Yeah.
74 ventilators.
So that's why we brought on someone in the person of Dr. Anthony Parkinson, who is leading that charge to make sure that all our MME, especially our intensive care equipment, if it's not being used, is being properly maintained. But I want to go back to the comment you made. You said that the curve was flattened. I just want to tell the national population, the curve was flattened not because of sunshine, not because of heat. It was flattened because of the work of this government, led by the Prime Minister,
and not by
led
what
by
you
the
call,
Minister of
not
Health,
by what you call the
led by the
Hindus,
Chief
Dudus.
Medical Officer, and led by every single medical worker. It was not flattened because of sunshine.
But you consider the worship of the sun to be voodoo, eh?
So, member for Barataria Sanwa.
On 04-1107, 04-1108, and 04-1109, I noticed that there are three loans for the central block.
Yes.
101.9, 70.3 million, and also 12.4 million US dollars. Could you, I don't know at this time, could you indicate what is the quantum or the ratio of local labor being used to Chinese labor at this point in time?
I don't see how
just
that
1 minute,
arises.
please, Minister of Health.
I don't see how that arises,
Minister of Health,
Madam Chair.
1 minute, please. I am not going to allow that question as posed by the member for the Barataria Sanwa. Okay? And because we're dealing here with the payment of the loan. Minister of Finance, I believe you wanted to make an
Yes,
intervention
Madam.
on these
Yes,
payments.
Madam
I will
Speaker.
allow that now. I'll
On-
ask you other questions.
Yes, Madam
I'll allow you other
Speaker,
questions.
I want to make the general point that 04000920, 04001005, 04011006, 04011007, and 04011008 are actions of the Minister of Finance, because these are interest payments and loan payments based on financing facilities which would have been arranged and guaranteed and executed by the Minister of Finance. And all of these have arisen for various reasons. They all flow from requirements, operations, and activities of the Ministry of Health. But it is the responsibility of the Minister of Finance to go and secure the financing. And what we do as a government, and this is not an unusual practice, this is something that has been done for years by multiple governments, is that having arranged the finance for all of these activities, the procurement of pharmaceuticals, COVID-19 pandemic, financing of the Arima Hospital, etc., all of these things here, the appropriation is then put into the respective ministries, in this particular case, Ministry of Health. So the Minister of Health goes out, invites proposals, makes a decision on who should get the financing, arranges the financing, signs the letter of guarantee, and so on. And then interest payments and principal repayments will come up during the fiscal year, and therefore all of these appropriations have to be made. Many of these things are done long after the budget. This is why they're appearing now for the first time. And in the particular case of 04011006, the UDCOT RBC Royal Bank, 16.9 million US, which is about 110 million or so TT dollars, the interest payment that we are now required to make in fiscal 2020 of $2,837,000 has arisen. The reason why I, as Minister of Finance, have to ask permission of the Parliament to supplement the appropriation for health to include this interest payment is because no financing was arranged by your government for the Arima Hospital. And I, as Minister of Finance, this year have had to make these arrangements to allow the hospital to be completed.
Member for Barataria-Sangre.
Could I ask a question to you, Minister of Finance, since you've said that you're responsible for financing? When you said in 04-11-06 that this interest payment is for a loan for the completion of Arima Hospital, the completion, which is the end, how was the financing arranged initially to start the hospital prior to September 2015?
There was nothing done.
Was.
Nothing.
There
You did
was.
nothing.
There
And
was
what I had to do,
Development Fund
what the PNM
that
government had to
10%
do,
to 50%.
was to arrange a series of financing arrangements over a
Ministry
period of
of Health
years to
used
finance the
the-
hospital. You arranged nothing. Not
You
one
arranged
red
85%.
cent.
You arranged 85%.
You
we
did
arranged
not
15%.
arrange a
Yes, we
red
did.
cent.
All right.
We had to do
All
everything.
right, all right now.
All right. I think again, I was assured we weren't going into the historical context. All right. Do you have any questions, Member for Barataria-Sangre? Member for Caroni Central?
A rather simple question, Madam Speaker. It's a follow-up from a question my colleague raised, and the minister explained it had to do with the ERHA, but the minister explained that that loan, which was increased, was in fact for all the RHAs, right?
Yes.
And initially, when I saw what was happening with the ERHA, I was wondering if they were doing anything different than the others. In other words, they were, for instance, what it says here is to finance expenses related to the regional authorities' COVID-19 pandemic projects and programs and meet expenditure under goods and services. And when I saw the loan associated here, I wanted to know if they were doing anything different. I still ask the question, in order to find out if in any way the ERHA is differentiated in either the things that it is acquiring or the work that it is doing in terms of COVID preparation and execution during the COVID period.
Just allow me to come in here first, please. I want to explain something. When the Ministry of Finance arranges financing for a ministry such as the Ministry of Health,
Yes.
the Ministry of Health has a number of regional health authorities, 4. And when we arrange a loan, in this case it is 500 million and then upsizing, the loan is not for any single RHA. It is the RHA that borrows the money guaranteed by government, and then that RHA distributes to all the RHA. So the loan is in the name of the Eastern RHA,
Right.
but it is then for the general use of the Ministry of Health for all the RHAs. Okay? So it's not for any particular RHA.
Yes.
It's for the entire RHA system.
As was said earlier.
Okay. Member for Faisalabad?
This next question, back to the allocation for the 4 RHAs.
Sure.
And you did indicate that the existence
Which
of the,
allocation? The
Sorry?
loan or the COVID response?
no, the COVID response.
Right, yes.
Separate from loans. And you did indicate that the parallel healthcare system was in place, and of course the Cuba Hospital would have worked in that system. But the point I'm asking now is that at the peak of the crisis, you know, you would know as I do that certain surgeries and so on would have had to shut down for purposes.
Elective surgeries only.
Elective surgeries. And now that they have restarted, as you indicated, there would obviously be a backlog and a waiting list. Can you indicate when you whether any of this allocation is going to be used, for example, to shorten that waiting list or to fast track or to facilitate those who would have been waiting for surgeries and other procedures.
So let me clarify. When a health system is preparing for an adverse event, whether it's a hurricane that you have notice of coming, a global pandemic, one of the first things you do is try to decant as many people as possible at a standard operating procedure. So all non-emergency cases go home, you cancel your non-elective surgery list. We restarted non-elective surgeries about 3 weeks ago or more, and we have made a substantial dent in that. We don't see any significant need for expenditure here to further clear up the elective surgery list. But if we do need so, it's there, because it can be related to a COVID expense.
All right. So you're saying that internal arrangements within the RHAs are facilitating the backlog?
Correct.
Okay.
Yes? Okay, so, honorable members, the question is that the 2020 appropriation for Head 28, Ministry of Health, be supplemented by the sum of $224,582,640. Those in favor say aye. Those against say no. I think the ayes have it. Head 28, Ministry of Health, has been supplemented by the sum of $224,582,640. Thank you, Minister.